Identifying the high risk rhinoplasty patients is critical for successful rhinoplasty. Some patients are difficult to satisfy no matter how perfect the surgery. Surgeons must recognize high risk patients early to prevent postoperative dissatisfaction and medico-legal issues. Importance of screening of these type of patient. Aesthetic surgery results are subjective and depends on patient perception. Unrealistic expectations or psychological disorder often lead to complaints, and understanding patient psychology is important to surgical skill. Body dysmorphic disorder (BDD) is a psychiatric disorder where patients are obsessed with perceived defect in appearance. There is minimal or no defect absolutely, but these patients are seeking for surgical correction multiple times with multiple surgeries. Incidence of these cases is about 6 to 15% of the candidate, and these cases are surgiholics, and they are constantly seeking new corrections. For rhinoplasty, there is two group of typologies of the patient are. First type is the Simon. Simon are high risk patient. S for single, I for immature, M for male patient, O for over expectant or over possessive, obsessive, and N for narcissistic. These cases are high risk patient. While other hand, you can see Sylvia cases, that is ideal cases. Sylvia means S for secure, Y for young, L for good listener, V for verbally good, I for intelligent, and A for attractive. These cases are ideal cases for the rhinoplasty. Red flag cases. You should watch these signs during consultation. First is body image concern cases. Second is unrealistic expectation from surgery. Third one is persistent worrying about appearance. Fourth one is use of makeup, clothing, and mask to hide perceived defects. Fifth is constant reassuring seeking. Sixth is mirror checking or complete avoidance of the mirrors. Seventh is avoidance of social interactions. Eighth is drop in quality of life. Ninth is repeatedly visiting different doctors, miss doctor shopping. 10th is numerous photos comparing themselves to celebrities. 11th is detailed ideas about how surgery should be done. 12th is other body image issues. And 13 is prior ineffective cosmetic surgery. These 13 factors are red flags for patient for rhinoplasty. So you should ask these question about, and you should know about these factors before going for rhinoplasty. If you see rhinoplasty improvement outcome, realistic result are maximum 40%. You can possibly get the result up to 60%, but 80% or 100% result are unlikely. So it means satisfaction rate is almost between 40 to 60% in rhinoplasty cases. First scale is aesthetic improvement scale. Its grading is from 1 to 5. One grade means no improvement or worse than before. Grade 2 is minimal improvement, still cosmetically poor. Grade 3 is moderate improvement, noticeable but not ideal. Grade 4 is marked improvement and aesthetically pleasing. And fifth grade is excellent improvement and near perfect result is the fifth grade. Now second scale is functional improvement scale. Here grade 1 is no improvement or worsening of obstruction. Grade 2 is slight subjective improvement. Grade 3 is definitive improvement, still minor complaints. Grade 4 is marked improvement and minimal residual symptoms. And grade 5 is complete relief of obstruction. So combined outcome of both these aesthetic and functional grading. Category 1 excellent if more than 4. Good result between 3 to 4. Fair are 2 to 3, and anything less than 2 results are very poor. So poor results are not acceptable in rhinoplasty. So selection of the patient is very important. You should select, and consent and proper explanation of the patient is very important for cosmetic and any rhinoplasty surgery.